Hello, everybody. Good afternoon. Good afternoon. I am Dr. Barry, favorite board certified internist, founder here at drpiersblog.com, your author, speaker, soon-be podcaster, bringing you another episode of the Lunch and Learn with yours truly. Appreciate everyone who will join, is joined, and will share alike. For all you guys' support. Like I said, I always like to start off kind of giving all the props to you. Like I said, I would not be doing any of this, without your guys' support. So again, much appreciated on this end here. I'm excited about today's quick little Lunch and Learn. Hey, Shauna, thank you for joining. Excited about today's Lunch and Learn. We're going to be talking about, National Minority Health Month. For those who are unaware, I do have a public health as long as with my medical degree as well. So, this is going to be, I'm able to, I love these topics because I'm able to kind of bridge both of my, educational worlds with it to kind of, explain to you guys, the sheer importance, thank you, the sheer importance of, why this month is so important. So like always, I'm going to do a quick little homework, go ahead and share this to my personal page like we always do, that we'll get things started off quickly. Hey, Amanda, thank you for joining. Thank you for joining the live. Like I said, I think we're at episode 30. Oh, maybe episode 32. I think we're at episode 32. Wow, time is moving. We're counting down. Episode 50 will be here in no time. Thank you. Let's see. I'm gonna share this along. All right, so again, I apologize. Took a little bit more difficult than expected. So again, National Minority Health Month. Again, this is April. Like I said, April is a favorite month of mine. One, because we get, like we talked about in the last couple episodes, we get to talk about autism. We get to talk about all the, the good things about autism, and all of the efforts that are out there, and we're able to kind of highlight a lot of the great things just about it. Because again, for those who don't know, I do have a daughter who is autistic. My oldest daughter is autistic. But then also we get to follow it up right along with National Public Health Week. So again, and then we get to hit right along with, National Minority Month and National Minority Awareness Month. Like, yes, oh, thank you. Yes, it is. So it's definitely something that, I'm able to kind of touch on, and, I want to kind of hit home, just the sheer importance what it means to kind of talk about, this National Minority Health and, Wellness Month, and, why we need to, really, make this a yearly thing instead of a monthly thing where, most of our health-related topics kind of get pigeonholed in. So, when we talk about, National Minority Health and Awareness Month, I want to kind of, break down some of the different avenues that we talk about, especially from a public health standpoint. When we talk about the awareness, and when we talk about a lot of the health disparities that come about because of it, a lot of our big takeaways are like really 4 to 5 different modes, right? So we talk about it in reference to race and ethnicity. We talk about it in reference to socioeconomic status. We talk about it in the race in regards to geographical location, in terms of disability, and even sexual orientation, right? So when we talk about the minority assessment and minority awareness month, that we're really trying to hit home, especially from a public health standpoint, kind of all of these points here, right? It's not just minorities and race, but we have to think about whether people have a home or don't have a home, whether people are disabled or not disabled, whether people their sexual orientation is becoming an issue, because when we talk about just health disparities, the definition, sheer definition, is being able to notice a significant health difference based on just one issue. Based on one issue, we're able to say, okay, you have a problem because of this, and we need to kind of address it. And something that the public health aspect really tries to home in on is what are some of the things that we can do to kind of improve the situation, not for just one sect or one group, but for everybody. Because, when everyone's uplifted, when everyone's health is better, when everyone has, a proper place to stay, a proper way to get from point A to point B, everyone kind of benefits. And I think, especially in this country and everywhere worldwide, but in this country alone, I think we tend to kind of lose sight on it. We tend to kind of be so focused on maybe one area versus the other that we don't realize that, if we don't kind of, pull everyone up by like all of these different factions, we're always going to ultimately suffer. So I want to talk about it. Let's talk about it in terms of like the home, right? So we'll talk about it. I'm gonna go through 4 different like areas where the minority health awareness is gonna be so key. So let's talk about it in the home, right? If we break it down in the home, and we talk about certain neighborhoods, right? We know that certain neighborhoods have benefits than others. How many of you guys have been in areas where that neighborhood gets their grass cut, landscaping, great sidewalks, all of these things kind of happen in this certain part of town, and then you might drive a good 5 to 10 minutes down the street and you don't get that same welcoming feeling, right? So and that's a problem, right? Because safety becomes an issue, especially because again, if I don't have no sidewalks, now I kind of have to walk on the side of the road. Now I have to worry about someone hitting me, because all for the sheer fact that my neighborhood, because of the zip code, because of the location, because of the houses that may be out there, within that residence, doesn't get enough funding, and they can't afford to take care of the sidewalks. They can't afford to take care of the roads. They can't afford to have great landscaping and great scenery. So these are some of the things they get, and these are just like very small caveats, right? Tomorrow I'm actually gonna be writing, I'm posting a post on just the different. I'm just gonna list a whole bunch of different health disparities, kind of touching on like a lot of these different areas, just to kind of see like how pragmatic a lot of these problems are. We talk about, and we're still talking about the home. Let's focus on just the inside. Let's focus on just the infrastructure of it all. If you don't know, and if you don't know, you're under a rock. We have those in Flint, Michigan, right, where you've seen the pictures, you've seen the videos of just people turning on faucets of water and it's completely brown. Like it's not even like faint brown. It's literally completely brown, and that's that's a problem, right? That's an infrastructure issue, right? That's a medical issue, of course. Hey, Chesapeake, thank you for joining. That's a medical issue. That is a public health issue of national concern. And this, even though we know Flint, Michigan, was fortunately on TV and talked about almost as much as we needed to be. I dare some of you to Google like your local city and then see where elevated levels of lead is found. Again, I'm in South Florida, Miami, Palm Beach. Plenty of areas where the concentration of lead is much higher than it really needs to be, right? So this isn't just some isolated incident that happened, in Flint, Michigan. This is happening in South Florida as we speak. So this is definitely something that, again, we have to continue to home. We have to, to make everyone aware of the problem, because again, you can't fix a problem if you're not even aware that the problem is there. And that's why a month like this is key, because it helps us kind of highlight like, hey, we got problems and a lot of different issues, and like this is one. Let's talk about the disparities, especially when we talk about in the workplace. In the workplace, we have some places that don't give employee benefits. We have some places where wellness programs aren't there, where they can't be there. We have places where work-related injuries are a problem as well. These, again, just from a public health standpoint, is something that becomes detrimental, right? Because again, if you have to go to work in an unsafe environment, you run the risk of getting injured. You run the risk of not being able to work. And what happens if you can't work? You don't get paid. You don't get paid. You can't pay bills at home. If you don't pay bills at home, you could be out on the street. Again, this isn't something that we have to kind of draw these straws on. A lot of these things are very interconnected. So if we leave the workplace, right? So we talked about the home, we talked about the work. Let's talk about just transportation in general. I'm in South Florida. There plenty of cars down here. There's plenty of public transportation as well. But there's a lot of parts in this country where public transportation is either inadequate or absent completely. Inadequate or absent completely. So what does that mean? So if you have a person who may want to eat healthy, may want to live, may want to be more active, but they can't even get to the park, or they can't even get to the health food store, or whatever the nearest store is around them. What do they do? They're focused to deal with what's in their environment. So again, if I live in a place where there's no good-looking grocery store around me, so no fresh fruits, no fresh vegetables, but the only stores that are around me are stuff that it's a lot of snacks, a lot of cookies, a lot of stuff that does absolutely nothing for me. Like I'm literally trapped in this area. It's not their fault. They just unfortunately are in a location where transportation isn't good enough to be sufficient to where they need to be. So and again, and this is something again we touch on a lot, because even though when I talk about the home, I talk about the work, I talk about the school, the problem is that in this country, minorities are greatly affected at a much greater rate than anybody else, right? So we talk about like these pillars, we talk about like the standards of it, but we know that when I talk about the home, I know that minorities are going to be affected more. When I talk about transportation, I know minorities are going to be affected more. When I talk about workplace issues, I know minorities are going to be affected more. So this is why it's so key, right? It's difficult to say like, oh yeah, I want to help improve the public transportation in my neighborhood, without realizing like who's going to be more greatly affected, and who is and not even say going to be, who actually is, as we speak, is more greatly affected by the ills of having a lack of transportation, a lack of a good grocery store in the neighborhood, a lack of good playground facilities. Like who's going to be more affected? And that's usually the minority group that plays a factor. Hey Jen, thank you for joining. We're talking today about National Minority Health and Awareness Month. We're talking about some of the pillars of where minorities seem to be greatly affected in terms of where. Number one was the home. Number two was work. Number three was transportation, and last and definitely not least, school. Well, Steve, what's going on? Schools, right? Because again, and this kind of again all kind of become interconnected, because if you're in an area where the schools aren't great, and you're in an area where the neighborhoods aren't great, and for those who may not be aware, a lot of the funding from your school is based on the housing around it. So what happens if you're in a neighborhood where the neighborhood isn't well kept, where the neighborhood property value is low, and you happen to have a school there? Guess what happens? All of the money for the funding for that school comes from the taxes of that neighborhood. So you can see how this is already a problem, right? You can already see where if I'm in a poor neighborhood already, I'm in a poor home, and I'm around a whole bunch of poor homes, so my infrastructure is shitty. And then I have no transportation because the public transportation is shitty as well. So then I can't really go anywhere, so I'm kind of stuck in this area here. And then I have to go to a job that doesn't give me benefits, that doesn't provide benefits, that is an unsafe work environment. So I always have to run the risk of not being able to, continue to work, because something can happen at work where I'm not even covered for whatsoever in the first place. And then when we talk about like the school, all right, so what kind of school do you think I'm sending my kids to? I'm sending my kids to a school that may not have proper equipment from a technology standpoint, may not have as many computers, may not have as many books, to kind of get us, to where we need to be. And even when we talk about recess, right? Like I've been reading some stats where there's some schools where, because they're in lower income communities, they actually cause them to have less recess. And I know, like in my elementary school, I drove by it the other day, and where Barton Elementary, shout out to Barton Elementary, where the school was, where it used to be our huge playground, it's nothing but like what are those trailers, so they can have class. So so where when I grew up, I had a whole bunch of area to kind of play or run around and do during recess. Now they got a whole bunch of just those portables for class. So now they got less room for class. They probably most likely have less time to do any playground work, even if they're getting recess. I gotta assume they're getting recess, but we just gotta hope hope and pray that that's the cause. So this is where it becomes such a big factor for us, right? And for those, and we talked about the home. What happens if you don't even have a home, right? I don't know, I think Amanda's on here. If you don't have a home, and if you're homeless, right? So imagine all of these things, right, are multiplied, right? And now you're homeless, right? You have nowhere to stay, or you have to reside in shelters. So you're already not getting any of these resources. You're already not getting any of the support that you need. Of course, you're going to be sicker, right? Because again, I understand it is actually a blessing, right? It's actually a privilege, right, to be able to go see a physician when you have a medical problem, right? Because there's a lot of people who can't. There's a lot of people who can. I actually was talking to one of my patients who talked about the fact that their copay, right? Their copay is like $95. Like just to see me, the primary care physician, right? Their copay is $100, right? So think of what privilege you have that you can spend $100 to see someone when you're sick, right? And think about the amount of people who can't do that, right? So if I told you that to be able to see me, you got to spend $100, or you have to eat, or you have to put gas in your car, or you have to pay the light bill. What are you going to choose? You're going to choose all of these other things else, because those, again, in anybody's eyes, is the most important. But in this day and age where the health, and this is where the health disparity comes back into play, because there's so many different interlocking parts associated with it. A lot of times your health is usually the last, right? A lot of times your health is usually the last thing that kind of gets to from point A to point B. A lot of times you're not even you're not thinking about your health, right? You're just thinking, you know what, I got to get from point A. I got to just get to my job, who has no benefits, who has no wellness programs, with an environment safe so I can pay for my bills, in a house or an apartment where the infrastructure is bad, where the neighborhood's bad, where I may have to deal with an increase of lead and all these other issues from that standpoint, just so I can send my kid to a school who doesn't give them enough. Who can't? I'll take it back. I don't even say doesn't give them enough. Who can't give them enough resources to fully succeed like we need to succeed? Who doesn't even give them a time to be in recess to kind of relax and kind of mentally unwind. Like this, that's where the problem is. So you can see where the public health in me understands where we're having a problem, right? From the public, there's a lot of public health things where we talk about healthy people 2000, healthy people 2010, healthy people 2020, healthy people 2030, right? And honestly, we're talking about the same stuff every 10 years. We're talking about how do I help more people get better housing? How do I help more people get better schooling? How do I help more people find a home? How do I get more people to have better workplace environment? How do I get more people to have better transportation, right? These are just 4 or 5 of the things that we touched on. There's a slew of different issues that affect our health in such a way that we from a medical standpoint, of course you haven't seen a doctor in 3 years, 5 years, 10 years, because you unfortunately you got what you're dealing with is life or death, and that's where I try to be very cognizant in my practice. I'm trying to be very cognizant just in general, right? When I'm dealing with patients, I'm treating with patients, and I'm prescribing medications. I'm at the point where I know any medications that's on the $4 list, right? Because I always have to think okay, I already know this patient may have had to spend $100 to see me, so I got to be mindful when I send them with a prescription that it's not going to cost another $100. Because what are you going to do? Again, you got that life decision where I got to pay a bill or I got to pay for this medication. I'm gonna pay that bill. Who would it? So I think that's why I love this month, right? Especially National Minority Health Awareness Month, because it is something that kind continues to bring back light, right? Because again, we talk, and I think there's always this animosity, like, well, we don't want to, focus on the minorities, but we have to, right? We got no choice, right? Because all of those things I listed, guess which group, right, is always affected the most, right? When I talk about housing, guess what group is always affected the most? When I talk about workplace environment, yep, exactly. I'm all about that free at Publix, right? If you on blood pressure, diabetes, antibiotic medication, I'm sending you to Publix every time I can, because I'm trying to like I said, because I know it costs out here. So these are some of the personal, like all of these public health issues always disproportionately affects minorities, right? So when you hear this National Minority Health Month, understand that that's the reason why. Understand that we need a whole month. Like we need a whole month where we like look back and say like, okay, like what are we really doing for this huge population, right? Because it's not like this is a small population in the United States. It's a huge population that's becoming affected with all of these problems here. And and what can we do to make it so that by next year, in 5 years, in 10 years, in 20 years, we can actually say that we've done something. So again, tomorrow I'll be very interested. It's gonna be it's gonna be a quick read blog too, because all I'm doing, because I've been kind of scouring and doing my research and just kind of seeing some different health disparity facts, and I'm just going to be listing facts after facts after facts after facts, and just to kind of open everyone's mind up and say like, wow, like this is really a problem, right? And this is a problem that affects everybody, right? Because again, if one group is suffering, the other group is going to eventually suffer, right? There's not going to be a way where one group can suffer all this time and it not affect this other group, right? Like it's just impossible. Yes, I'm a big fan of Publix and Walmart, especially from a free medication standpoint. And then as a physician, I think it's on us as physicians and healthcare professionals, mental health care professionals, and all the people who are in charge, right? All the people who are in charge of taking care of others, my public health professionals as well. All the people who are in charge of taking care of others, and it's our job really to do things like this, where we're just kind of educating the masses and letting them know that we understand their struggle. Like I said, I got patients who I just say, what, don't even, don't come to my office for like a cold or something. Just call me. I'll send the antibiotics over there. I don't care, because again, because I can't think about it. You got $100. Like I think it blew me away. Like it was shocked. He was like, yeah, my copay is $100 to see you now. And that's unfortunate, and that's sad. That's the problem, and that's the reality for a lot of people. Reality for a lot of people who will be watching this, who are watching this, who will be watching this later, who are friends of people who are watching this later. You likely know someone who's in a home, that's not as efficient as it's supposed to be, who lives in a neighborhood that's not as efficient as it's supposed to be, who goes to work in a place that's not as efficient as it's supposed to be, who has to travel to and fro in a system where they gotta carry buses, or they gotta go in a car that's unreliable, and they got that risk there. Who has to send their kids to school, send their nieces, their aunts to school, who may go to a school themselves, right, where the resources just aren't there for them. And that's at the end of the day, this is why we do. This is why I do these lunch and learns, to really kind of continue to spotlight everything that's kind of moving forward from the health front, and understand that we definitely feel your pain. We definitely and we're trying to work. I say we're, but some of us are trying to work. Some of us are very cognizant of the issues that you're kind of dealing with. And whatever I can do, I'm gonna do to kind of help get you guys to that better level. Because again, it's disingenuous of me, right, to expect you guys to be as healthy as you could be while ignoring everything else, right? Like, yes, you're a diabetic. Yes, you have hypertension. Yes, you have high cholesterol. Yes, you have all of these things here, right? But if I just totally ignore the reason why you have all of these things, that's a problem, right? And I'm only doing a half-assed job as a physician. So again, tomorrow, look out for blog posts in the morning. If you have not, go ahead and sign up for the listserv, so I'll make sure it goes straight to your email box. If you haven't joined my my private group as well, go ahead and join that. Let me. I think it's text. I'm gonna put the information in the comment. There is group 244222, or just search it. So you can go ahead and text, text that code to that number, and you'll get a link to the group. Or you can just, especially if you're watching me on Facebook, you could just, I think if you search Dr. Barry's like Health Squad, it should pop up, whatnot. So again, you guys, again, much appreciated for the likes, the comments, much appreciated for all of the support you've done. Again, I think this is episode 32. I'm having a great time. I'm loving what we do here, and I just hope to continue educating you as much as possible. Now, you guys have a great, blessed day. I will see y'all later. Bye.